presentation this year is Heart Health in America, and my call to action is how I help my community understand their heart health. So a little introduction about me, because I'm fairly new at Lincoln Lutheran. My name is Hannah Ferris. I'm a senior here, and I have a really big passion for nursing. I plan to go to Union College of Nursing next year to study international rescue and relief and trauma nursing. So my personal connection with heart health is that my family has a really big history with heart problems, both congenital and preventative. Unfortunately, in 2008, my grandmother died of a sudden heart attack, and my sister Rachel has a heart condition known as postural orthostatic tachycardial syndrome, which has impacted our lives tremendously since the diagnosis last year. So after learning about my family's medical history, I sought to educate myself on this so as not to meet the same fate as my grandmother and to help my sister overcome her condition. One of the things that I found out is because my family history of heart disease is so big, I will most likely die from heart disease, probably around the age of 50 to 60. So that's a little depressing, but it's made me realize that because my life is so short, I need to focus on my health and pick up on the things that I need to do. So first, I would like to explain what heart disease is and what I will be specifically talking about. So I'm talking about coronary artery disease, or CAD, and that develops when the major blood vessels that supply your heart with blood, oxygen, and nutrients, or your coronary arteries, become damaged or diseased. A quote from the Mayo Clinic is as described, and it just basically talks about how the coronary artery disease eats away at your arteries until they're pretty much nothing. So coronary artery disease is a condition because of plaque deposits of cholesterol in your arteries causes major blockages to your heart, causing heart attacks. So the CDC stated in 2008 that 23.5% of American deaths were because of heart attacks brought on by coronary artery disease. That means out of 308,745,538 Americans in 2008, 72,555,201 died from heart attacks brought on by coronary artery disease. Out of that 23.5%, the majority that died were African American women and Caucasian men. Studies also showed that American culture and our food preparation have more of an effect on these groups rather than Pacific Islanders and American Indians that were also included in these statistics. So that number has drastically decreased in 2018. Only 610,000 Americans died from CAD-induced heart attacks, and around 735 Americans will suffer a heart attack unrelated to CAD. So what was my action project actually on? I'm going to explain how my community reacted to my project, especially given the fact that I worked with young children who were not as enthusiastic about this as I am. So what I couldn't do, many clinics wouldn't allow me to volunteer simply because I'm just not old enough and I'm not a registered nurse. My original plan was to volunteer at a heart center to see exactly what CAD did to those affected, but most health clinics, whether related to cardiology or not, like I said before, require volunteers to have some kind of medical licensing to practice. I only have my basic CNA training, which is my certified nursing assistance training, and I was unable to volunteer for age and prior training. What I could do, however, was because Trinity is right next door, and my youngest sister Sarah is a 4th grader there, I also teach cheer after school on Mondays there as well. So I figured, why not try and set up a time that I could do something at Trinity, maybe some kind of demonstration. I couldn't go to clinics, like I said before, and I didn't really want to stand out like at Walmart or something, hand out pamphlets, because people don't really take too kindly to people who do that. So my mom suggested that I talk with my sister's teacher about possibly doing a demonstration during PE class, which is what I ended up going with. So before I went in, I made a list of things that I knew I needed to know and what I would learn from this. I knew that children weren't as interested in heart disease as I am, because it is a very kind of depressing topic to talk about, especially if somebody's planning on like going into surgery to fix heart disease. And there were a few kids in my sister's class who had parents. One actually had a parent suffer a heart attack 3 weeks before I did this presentation, so he was not very happy with me. But things that I needed to know were how to break down a complex disease into simplistic terms without twisting the diagnosis. Heart disease, or CAD, is pretty complex when you get into it. If not treated properly, it can affect the walls of your heart and even just take over the muscle in general. And so trying to make it easy for 9, 10, 11-year-olds to understand was very difficult. And then the one thing that I learned was that children do not like physical activity, especially when it's me teaching them, because I'm not very forgiving when it comes to PE class. So the actual event took place on April 26th at 1 p.m. when the kids would normally have PE. They weren't thrilled when I told them what keeping your heart healthy entailed. A vigorous cardio workout, maintaining a healthy BMI, and eating vegetables. One child even said, well, I'd rather have a heart attack than eat my vegetables. This proved my theory that Americans don't generally do what is necessary, but what is convenient or pleasing to them. As a child, I didn't like vegetables either, but when I realized that my heart health is more important and that I'm more likely to susceptible to heart disease, I realized that it should become part of my normal diet. So what I showed the kids was what the human heart looks like, how it works like your body's pump, and how it stays healthy. Next, I brought out a couple of things that don't look like they match at all. I brought out toilet paper rolls, a bucket of water, and a tennis ball. The toilet paper rolls work as inexpensive stethoscopes. If you use it on a spot where you normally find your pulse, like your wrist or your neck, you can listen for it very briefly. I remember doing this activity when I was really little, and I thought it was kind of dumb when they first did it because I couldn't hear anything. But as I grew older, I realized that maybe this isn't, so bad. But the tub of water and the tennis ball were used as a demonstration of how your heart pushes blood through your body, and when it contracts, the blood goes to places it needs to go, like your extremities, your trunk, and your head. Lastly, we played a game of line tag. If you don't know what that is, it's basically tag using the basketball boundaries on the gym floor. You can run along those lines only, and if you don't, you're out of bounds and disqualified. So I use this to my advantage. The lines are your veins, and those who were collectively called heart disease. It was to show how heart disease eventually takes over and dominates your heart, and it worked. These kids started to understand how heart disease kept eating away at your veins and your arteries, and they needed to keep their bodies healthy to keep that from happening. So what could I have done differently? The event could have been executed differently. I definitely could have worked on my delivery of it because I was definitely a little bit tougher than I should have been on the kids, especially since most of them didn't know what coronary artery disease was. I should have used an older group of children because I worked with 3rd, 4th, and 5th grade. The 3rd graders didn't have any idea what I was talking about. It went in one ear and out the other for them. And the 4th graders, I think they only listened because my younger sister is in that class and they wanted to be respectful. And the 5th grade was just kind of like, that's kind of dumb, I don't know why you're telling me about this, it doesn't really matter, I'm not going to die of heart disease anyway. I needed to remember to make it fun, because when I was a kid, I wasn't a normal child. I didn't enjoy doing things like games. I liked learning about things like this. And so for me to kind of go back to my childhood was a little bit more difficult because I wasn't like that at all. The last thing that I have is what can I do to understand my heart? So this app I have on my phone to track my heart is called Cardio, and it's a free app on the App Store, and it's designed for people at risk of heart disease, or if you're just curious about your heart health in general. It can track your heartbeat, monitor your blood pressure, and provide you with workouts tailored to your heart's needs. So this is very helpful for me, especially since my heart is definitely not in the best condition, and it has drastically improved my health over the past 2 years that I've been using it. So that is all I have. Thank you for listening, and I hope you guys tailor to your heart's health.